Hi class, welcome back. Now that we've covered all four types of tissue, the very first system that's discussed is one called the integumentary system, which is like skin, hair, and nails. The skin is made up of all four types of tissues that we've talked about. The skin is made up of epithelium, it's made up of connective tissue, it's made up of muscle tissue, and nerve. So in the epidermis, in this top layer, we're going to have epithelium. And in the dermis, which is lower, we're going to have some connective tissue. But there's also muscle and there's also nerve, right? So we have all four types of tissues here. There's some connective tissue here, right? We talked about fat. We've talked about blood vessels, okay, liquid connective tissue. So pretty neat, right? How what we've just spent some time learning now, okay, I understand, right? In order to talk about and move on to bigger and better things, we have to get into the basics. So with the skin, the top portion is called the epidermis. Just below it is the dermis, and below that is the hypodermis. So it's kind of like three layers. Now, microscopically, the epidermis has, I call it 4 to 5 layers, microscopic layers. When we have thin skin, areas in which we have thin skin, it only has 4. And in areas where we need thicker skin, thick skin, we're going to have 5 layers. In the dermis, there's 2 layers only, papillary and reticular. And then you can see down in the hypodermis, we got some blood vessels and fat down here. What else do we have here in the dermis? We have sebaceous gland. You know what that is? That's an oil gland. That makes oil. So you can see we have the hair shaft. So when your sebaceous gland secretes oil, it moves right up the shaft of the hair and creates this like watertight seal between the hair and the skin. We have muscle right here. We have muscle, and that's called the erector pili muscle. You ever like sometimes you're walking and it feels a little dangerous behind you and the hair on the back of your neck stands up? You ever hear the expression? Or old blackboards, you can scratch your nail on the blackboards and you get goosebumps. Well, the goosebumps come from the erector pili muscle contracting, making the hair stand on end. It's like an alert. And then we got nerve stuff. We've got lamellated corpuscles. These are pressure receptors. These are pressure receptors. And then we have sweat glands. That's a sweat gland. That's a sweat gland. So we got a lot going on here, right? A lot going on with the skin. Skin has a few different cells, keratinocytes, melanocytes, macrophages, and tactile cells. The majority of the skin cells, like 90% of them, are keratinocytes. Melanocytes, they produce melanin for skin pigmentation. The macrophages, that's part of your immune system, right? If something invades the skin, we got to attack it. Your skin is your first line of defense. And then you got tactile cells, right? Did you step on something? Did you get bit? Is there a bee crawling on you, an insect on you? You have to be able to tell these things. All right, so when we look at the epidermis, top layer of skin, I said there's 5 layers, microscopic layers. They all start with stratum. Stratum like stratosphere. It's a layer. So we have a stratum corneum, a stratum lucidum, a stratum granulosum, spinosum, and a germinatavum, aka stratum basal layer. So these are kind of like interchangeable. So we have 1, 2, 3, 4, 5 layers. Now, little silly mnemonic, Cher loves getting skin Botox. Cher loves getting skin Botox. And that's from superficial to deep, right? Because this is the surface. Look at how many layers the stratum corneum is. Oh my goodness. If this is the apical surface, it's super thick. Down here, In the stratum germinativum, aka stratum basal layer, you've got stem cells down in this bottom layer. Stem cells. And these stem cells develop and they push upward in this direction. They start down here and then they move up and they migrate to the top. And it takes 4 weeks to get to the top layer. This is all dead cells. The stratum corneum is all dead. This all sloughs off. You could see it here starting to slough off. And then you make new ones. Don't worry, we'll make more like Doritos, right? So the stem cells keep producing more and more and they push them up. And you have UV rays coming down. And if you get damage to some of these, you get basal cell carcinoma, skin cancer. Okay, so this just shows the different layers again: stratum corneum, granulosum, spinosum, and basal. Okay, the layer that we don't see here is the lucidum, right? Cher loves getting skin Botox. So since we only have 1, 2, 3, 4 layers, we don't have the lucidum. 4 layers is thin skin. 5 layers is thick skin. So where do we have thick skin? Palms of the hands and soles of the feet, much thicker. That's going to have the lucidum layer. Where you have thin skin, no need for it. Okay, so stratum corneum, dead cells. Stratum granulosum, it's very granular, and these granules release lipids or fats. The stratum spinosum, it's spiny layer. It's made up of pre-keratin. Down in here, the stratum basal layer. These are made up of stem cells, right? So these cells move up, they migrate upward. Again, it takes 4 weeks. What else do we have here? Langerhans cells. These are immune cells. They're immune cells. Right here, melanocyte. I'll put an M here for melanocyte. What does melanocytes do? When the UV rays are coming down, we don't want them to damage your stem cells. So melanocytes produce melanin, this pigmentation, and it acts as a shield, right? It just makes that pigment and it moves up so that the melanin is black substance. So as the UV rays come down, the black absorbs that substance, protecting your stem cells from any type of damage. Pretty cool how that works. Okay. Below the epidermis, down is the dermis. Okay, so we've seen this. This is the skin, thick skin. There's the hint, thick. That's why we see the lucidum. So Cher loves getting skin Botox. Those are the different layers from superficial to deep. The 5 layers here make up the epidermis, and then below, that's the dermis. Okay, so if you look at that a few times, you'll be able to remember that mnemonic. You'll be okay. These are these epidermal ridges. These ridges, these hills, they're involved in making a fingerprint. Everyone has a different fingerprint. All right, so what's the highlighted layer up on top? Well, that's going to be the epidermis. What's just below that? That's the dermis. What's below that? Hypodermis. Top layer of the skin. Cher loves getting skin Botox, so that's the stratum corneum. This is Cher loves. So what's this one right here? That's the stratum lucidum. All the way on the bottom, what's this highlighted structure? Well, it's either the germinativum or the basal layer. So germinativum is not a choice, but the stratum basal layer is. That's the deepest layer. Okay, now we've got these ridges here. They make these mounds called papilla, dermal papilla. These are involved in making the fingerprint, dermal papilla. They're extensions of the dermis going up. It's involved in making the fingerprint. Okay, just a few things in terms of skin color. Cyanosis. Think of printers. The color ink, cyano, is blue, right? Blueness. If you have decreased oxygen, the lips turn blue, fingernails turn blue. Erythema, like erythrocyte. You get an insect bite, allergies, rashes. It's erythematous. It's red. Usually inflammation, sunburn, even if you're embarrassed sometimes, right? Erythema. Jaundice is yellowing of the skin. Now, if you're a darker complexion and you can't see yellowing of your skin, look at the white of the eyes. The white of the eyes. It's typically involved with some sort of liver malfunction or liver disease, right? Just look at the sclera. Albino, it's when there's a genetic lack of melanin. This is when children or people appear fully white throughout their entire body, including their hair and even their eyelashes. And now let's just finish up here with the nails, pretty short. Let's just look at the main parts of the nail. This is the free edge. This is what you cut. Then you have a nail body, should be pink. And the half moon, lunula, and the cuticle is called the empochium. The nail root is right back here. Past the root is called the matrix. And like the skin, the matrix is made up of a bunch of stem cells. And just like those stem cells, they move upward and they push the nail up. So when we look at the nail from the side view, right, we're looking at this right here. So here's the free edge of the nail. Here's the nail body. Here's the lunula. Here's the cuticle. And then here's the nail root. And just behind it is the nail matrix right back here. And the matrix is the epithelium that's proximal to the nail root. And it's got those dividing cells that produce new nail cells. Pretty cool. Okay, so what is this? That's the nail body. What's this part? That's the nail root. Now, what's kind of neat is when I do a physical exam on patients and I shake their hand, you can look at the nails and pick up a lot of diseases by looking at the nails. When you see this type of appearance, it's called clubbing. See how the cuticle gets very, very thick and the nail goes down like that? That's typically involves some sort of lung disease, like lung cancer or even like heart failure due to poor, decreased oxygen throughout the body, typically gives that. We also see clubbing seen with irritable bowel syndrome or irritable bowel disease. Look at that thickening there. We typically see that with inflammatory bowel disease, even cardiovascular disease. That's clubbing. When we look at the nail bed, this should be pink. When it's pale and white, it's an anemia. Maybe it's iron, like an iron deficiency anemia or B12 deficiency anemia. Their heart could be failing to pump the oxygen throughout the body. It could be malnutrition for B12 or malnutrition for iron, and even liver disease. Usually anemia, pretty common. I seen this in a patient just a few years ago. This is a type of cancer, often seen in darker complexion individuals. So we want to be, although skin cancer affects the skin, it also affects the nails. This is called a subungual melanoma. It's a dangerous type of skin cancer, and it causes this strip or this stripe of change, and they become darker over time. You see these like candle wax appearance, looks like, these ridges that we see here. This is typically endocrine. We typically see this in endocrine conditions, endocrine disorder. So diabetes is an endocrine disorder. Thyroid issues, Addison's, these are endocrine-like disorders.